how threatened humankind feels in front of a virus that attacks their first line of defense, the immune system. In a world with millions of people living with HIV and AIDS, it is time we tackle this epidemic together through global partnership and innovative approaches between nations to halt and reverse HIV and AIDS infection. Some have begun to see this bigger picture. Beyond horizons, to share and learn, Africa, considered the cradle of humankind, home to one of the greatest of civilizations. With enormous mountains, tropical rainforests, grassy savannas, large deserts, biggest swamp, and the world's longest river, she boasts of a rich, unique, and diverse culture. Africa is also fast becoming an important player in the global economy, with several African countries reporting steady growth over the last several years. The Republic of India is the largest democracy and one of the world's fastest growing economies. India is a highly diversified, multilingual, multicultural, multi-religious nation. India and Africa have a shared historic relationship that is rooted in its struggle against colonialism and apartheid. We have in common not just the status of being developing countries, but also our common day-to-day struggles and issues. India and Africa have cooperated in the past on healthcare issues. Eradicating smallpox and polio were among our successes. HIV and AIDS is our ongoing fight. Around 75% of AIDS-related deaths are happening in sub-Saharan Africa and India together. India's approach for tackling this infection were focus on prevention, comprehensive and innovative strategies for most at-risk and mobile population, standardized approaches in prevention and care programs, support systems for quality improvement, evidence-based interventions, community ownership of programs, and country stewardship through National AIDS Control Organization. This has resulted in increased domestic resources, engagement of civil society and private sector, and enhanced and enabling environment. Several of these good practices can be easily transferred to other countries. While African countries had a leading edge in HIV care support and treatment, integration with ongoing health programs, multi-sector response, new technical approaches, for example, voluntary male circumcision, test and treat, and many more have been introduced to prevent new infections. There have been several areas of cooperation between India and many African countries, such as education, industrial development, and in many others. As a pioneering initiative to promote cross-learning between India and African countries, SHARE, South-to-South HIV and AIDS Resource Exchange Project, was launched. The SHARE project, established through cooperative agreement between USAID and the Voluntary Health Services, is mandated to promote cross-learning and disseminate good practices and innovations in national AIDS control programs between Indian and African countries, institutions, program planners, and policy makers. SHARE will facilitate bi-directional transfer of good practices and innovations in HIV and AIDS programs between India and many African countries. SHARE project will be undertaken on a pilot basis in the Eastern, Western, and Southern African countries. The project focuses on 3 key domains, which have the potential to be game-changing for the participating countries. Domain 1: HIV and AIDS governance and country ownership that includes partnerships with civil societies and private sector, strong government leadership to facilitate high-impact policies and practices, developing methodologies to communicate and share country experiences for creating an enabling environment and ensuring resource allocation. Domain 2: state-of-the-art technical approaches in the delivery of HIV and AIDS prevention, care and treatment services that have the potential to enhance the quality of intervention deploying systems, ensuring community mobilization and private sector engagement for improved efficiencies. Domain 3. Best practices with respect to the support systems, which include strategic information, data-based decision-making, human capacity development, and financial and procurement management that underpin the delivery of HIV and AIDS services. The proposed activities within the countries include conducting needs assessment, facilitating guided exposure and exchange visits, organizing thematic workshops, short-term fellowships, providing virtual technical assistance, holding health expositions, developing learning sites, in-country experts, and fostering joint initiatives between countries. Customized, need-based, country-specific operational plan would be devised with mutual consensus. The anticipated outcomes of this project are increased coverage of prevention and care services, improved quality of interventions, greater efficiencies in national HIV and AIDS programs, enhanced capacities of local institutions or experts, twinning arrangements between Indian and African institutions. SHARE is efficiently managed by a team of experienced professionals who form the core management team. SHARE project will also engage national and international experts from public, private, and civil societies in order to disseminate and help in transferring good practices. The time has come for India and Africa to renew their age-old values of goodness and to refresh, unite, and strengthen the bonds of friendship and care, and to involve more deeply to support, prevent, and incline to the needs and aspirations of their people, and in fulfilling their dreams of a healthy tomorrow.